Hello there, Elizabeth Scala here from elizabethscala.com. So we continue on our journey discussing Reiki and nursing and the two practices and how they can complement and increase each other's effectiveness. So I introduced you very briefly to the concept of Reiki in last week's video. This week I just talk a little bit more about what Reiki is, what Reiki is not, and just dispel any myths or share any facts that may be relevant to questions you may have. If you have any other questions after watching this video, be sure to leave a comment below so I can answer any that come in. So Reiki is a complementary practice. It is not alternative, as it's not better than or used instead of conventional medicine. So I am a registered nurse. I practice Western medicine. I work part-time in a hospital. And I'm not saying these things are wrong or bad. They're actually very good and very necessary. What Reiki is a complement to what happens in Western medicine and can really just uplift and up-level any of our Western medicine practices. Reiki is a spiritual practice, yet it is not a religion. There's no dogma, there's no rule set. You're not following one specific thing. You're not praying to any god or goddesses. So Reiki is spiritual in nature. It's like a meditation. The interesting thing about Reiki is the practitioner is not as involved in practice as, say, a physician or a nurse or an acupuncturist or massage therapist, where they are assessing the problem, coming up with a diagnosis, and then evaluating the treatment they did. In Reiki, the practitioner simply is in a meditative state, allowing the Reiki energy to flow, and just looking again for the highest outcome in the greatest sense of well-being. Now, this may sound a little abstract, and for nurses who want to know the real structure and the step-by-step plan, it is a little bit difficult to grasp. The easy thing for us nurses to grasp, though, is that Reiki is all about energy. So the word itself, Reiki, universal life force energy. So as nurses, we can say we are made of energy, our physical bodies, our organs, then their tissues and their cells. And what are cells made of? Protons and neutrons and atoms and energy. So Reiki is an energy technique, practice. So that's a little bit more about Reiki without going too in-depth, because the more we articulate Reiki, the more it becomes confusing. I always tell people I share Reiki with, or my class participants, the best way to understand Reiki is to receive it, to practice it, just to feel and experience it. So if you have a Reiki practitioner nearby and you're getting curious, you may want to do that. Otherwise, you can check out my website, elizabethscala.com, as I offer Reiki training, Reiki teaching, and Reiki practice for nurses. So thank you for watching, and we'll see you next week, and enjoy your health today.